Good afternoon, everyone, and welcome to our webinar today. My name is Catherine Boatwright. I'm the Director of Operations for National Voluntary Organizations Active in Disaster. National VOAD, is what we're commonly known as. If you're new to our organization and what we do, we're glad you're here today to listen and learn alongside us. Today, we continue our Adapting to COVID-19 webinar series. And today, we'll be taking a special look at mental health. As we all know, outside of the physical implications of this pandemic, the mental health implications are vast and extreme. And so today we have an esteemed panel of practitioners and experts who are going to share with us what they're doing and how they're doing it so we can all learn from them and hopefully implement it into our own communities. So I will turn it over to Greg Forster, our President and CEO, for some opening comments.
Good afternoon, good evening, everybody, depending on which coast that you're on. I want to thank you for joining us today. I know all of us have been moving from one Zoom call or WebEx or other means of communication as we look to go ahead and reach out to our communities that have been COVID affected. We know so many of you have been engaged in this work, everything from feeding individuals to checking on those that are in nursing homes to just checking on your neighbors. So tonight, we're hopeful that you'll receive some pointers from our professional group and panel that we have as to how we might engage in this work and maybe a little more thoughtful process and maybe some cues as to how to do it maybe a little bit better. So with that, again, thank you, and let me turn it back over to Catherine to guide you through this afternoon.
Thank you, Greg. So part of National VOAD's mission is to provide a forum for promoting the 4 C's: cooperation, communication, coordination, and collaboration. And COVID-19 has created nothing short but many new challenges and extreme environments. And because of that, we're seeing mental health toll on individuals really across every population. And so today we're going to focus on those implications and to see what we're doing, what's working, what's not working, and what's down the road that we can help prepare for. And then, of course, how can we better partner together to help meet these needs? So I will briefly introduce our panelists, and then we will get started. We have Roger Roberts from National Organization for Victim Assistance, also known as NOVA, Christian Burgess of Vibrant Emotional Health and the Disaster Distress Helpline, Captain Eric Herholzer of the Substance Abuse and Mental Health Services Administration, also known as SAMHSA, Seth Davis of IsraAid, and Natasha Medina of Team Rubicon. So thank you all so much for being here. I know it is incredibly busy times, but you are an incredibly valuable asset, and we're excited to hear from you. I also want to give a shout out and special thanks to Team Rubicon and Dennis Clancy, who provided coordination and technology support for this event. So thank you to them. Okay, so briefly, I would love to hear from each of you and just take a minute to introduce yourselves, tell us what your organization is doing in COVID, yeah, just briefly, and then we'll take a deep dive from there. Christian, we'll start with you.
Sure. Well, thanks, Catherine and Greg and everyone at National VOAD and my panelists for the opportunity to talk with everyone about mental health during COVID-19. My name is Christian Burgess. I'm director of the Disaster Distress Helpline, which is a program and funded by the U.S. Substance Abuse Mental Health Services Administration, or SAMHSA, as Catherine said, and administered by my parent company, which is a private not-for-profit, Vibrant Emotional Health. Vibrant are also members of National VOAD, and we also operate NYC Well, which is New York City's crisis assessment intervention referral hotline. And the Disaster Distress Helpline is a sub-network of the National Suicide Prevention Lifeline. So the Lifeline and the DDH are in the same family of services under SAMHSA. And so in the talk, I'll be talking a little bit about not just the Disaster Distress Helpline, but also the Lifeline. So that's a little bit about who I am. And, you know, certainly we've seen an increase in calls to the Disaster Distress Helpline. We received over 300% increase in calls in March compared to the month prior. And almost 900% increase in calls compared to the year prior, the same time period. So got lots to talk about and just excited to be here.
Thank you. Eric, let's hear from you next.
Good afternoon. Thank you for having me. Just in terms of a little bit of background of my role at SAMHSA, I am the the core for the Disaster Technical Assistance Center contract, which provides a lot of really great resources related to disaster mental health and substance use disorder, or as we say, disaster behavioral health. And so in addition to that, I'm also the team lead for the FEMA Crisis Counseling Program, and that is a grant program that makes funding available to states, territories, and federally recognized tribes in the aftermath of disaster. And that funding is for the purposes of behavioral health outreach and resource linkage, stress management, and assessment and referral for those that are having a more severe reaction to a disaster. So we are currently, because of the COVID-19 disaster that we're all experiencing and living under right now, we are having a large rollout or increase in the numbers of states that are eligible for CCP grants. So far, we've awarded, or in the process of awarding, about 10. We also got just this afternoon 31 additional declarations for CCP grants. So we're going to be quite busy in the near future here as we look to provide services for everybody that's experiencing this disaster. One of the things I'll probably talk about a little bit more in the Q&A session is, the nature of our program being sort of an outreach model. Obviously, there are implications for that model related to the current situation where many communities are, practicing social distancing, and it probably wouldn't be appropriate for teams of paraprofessional outreach workers to be going door to door. So, but I'll talk. We can get into that a little bit more later in the webinar. So,
Great.
Thank you,
Seth.
Yeah, hi everybody. Good afternoon, good evening. My name is Seth Davis. I'm the CEO of Israel US. We're a non-governmental, non-political nonprofit that was established 20 years ago in Israel, and also 501c3 in the United States for the last 4 or 5 years. We've deployed to over 52 countries, and as we speak now, we're still active in 15 countries. And I want to give a shout out to our heroic team leaders that chose to stay on the ground and work with the communities and not go back to their homes, although the dangers of COVID, and actually help where most needed. I also want to applaud National VOAD as a member and to the fellow members for putting mental health on the forefront. We see a lot of focus on PPE and food security. This is really, really important, but mental health is just as important and not being recognized. So I'm really honored to be part of this conversation. We call it the invisible or the unseen injury, and it's very severe, and it can be treated less than the same level of severity of any other focal point. So as we speak in the US, we've also launched a self-care webinar. A lot of our fellow members here are on the forefront, and people dealing with very tense situations, including the household and also the people they're taking care of. It's really important we all take a step back and care for ourselves. If we're not resilient and balanced, we can't help other people. For that, we've created a very simple, basic webinar called 12 Ways to Reduce Anxiety and Stress. I know it's been published on the National VOAD website, and we've had quite a few members participate. And I urge you all to take the 45 minutes, take care of yourselves, to then take care of your loved ones and your community members. Thank you so much.
Seth. Natasha.
Hey, Catherine. Thanks for having us. So I'm Natasha Medina. I am the Volunteer Management Manager with Team Rubicon. So Team Rubicon, if you don't know, we serve communities by mobilizing veterans to continue their service, leveraging their skills and experience to help people prepare, respond, and recover from disasters and humanitarian crisis. And so my role here at Team Rubicon is really just providing direct support to our volunteers as well as volunteer leaders, improving that gray shirt experience, which is really just the volunteer experience. And then also helping manage leader and behavioral expectations, as well as finding the right resources for our volunteers when they do need assistance.
Great. Last but not least, Roger.
Hi, and thanks to VOAD and everyone for inviting Nova to be a part of this presentation this evening or this afternoon for some of those folks. For those of you that aren't familiar with NOVA, the National Organization for Victim Assistance, we're primarily a not-for-profit agency that is geared towards training, education, and credentialing for victim advocates and crisis responders. So we have been kind of in the same line with Seth. What we're looking at right now is that we have folks that are on the front line in all of those communities that are victim advocates, whether they work at domestic violence shelters, sexual abuse centers, any one of those areas. In our crisis responders, there's been an increase since COVID-19 with domestic violence, exploitation, with youth being home so often, child abuse. And so we're really kind of gearing some of what we have been done or what we do in the past more towards caring for the caregivers that we have out there, those folks that are still trying to do those jobs and trying to in a changing environment for them as well. And so we'll talk about kind of, some of the specific things that we're doing for folks, but that's kind of where we're at. Normally we do national response as well, but what we're trying to do is get to our folks that are on the ground to make every national person that we have trained a local response.
Great, thank you so much. So as I said, we have an esteemed group here with us today, ranging in number of populations that they're serving across the United States and the world even. So what I'd really like to look at first is just what are we talking about as far as mental health? What are the realities and the implications within a COVID-19 environment of what what people are facing mental health wise? I just read a Scientific American article that said that the psychological trauma is the next crisis of COVID-19, and I don't think any of us have any problem believing that, seeing what we're seeing. So I'll open it up to the panel. What are you seeing out there as far as mental health needs currently?
Well, I can jump in and get started with that question. I think it's a really important question. And in disaster behavioral health, there's a saying that's no one who experiences a disaster is untouched by it. And I think one of the realities of COVID-19 is that pretty much every single person in America is impacted in some way. I mean, I would even dare to say globally that the vast majority of the population around the world has been impacted by this pandemic in some way. And certainly that's one of the realities that we're dealing with right now in terms of the need for the scope of services that many of us here are representing and that we'll continue to see in the weeks and months ahead. And I do think we're looking at a long-term recovery related to COVID-19, and that will come in various phases. Before the webinar began, those of us on the panel were talking about the phases of disaster and how there's many disasters follow that traditional trajectory of pre-impact, impact, and then there's a heroic and honeymoon phase where there's a lot of community cohesion and coming together. Then you start to see some downward trends in terms of moods, where what we call the disillusionment phase, where some of the realities of the situation are starting to come in. People then start to work through their grief and come to terms with any personal impacts they had with the event. That can take months or even years for some people. And eventually we get to a point where we call reconstruction or a new beginning. And I just think that what I'm observing through the disaster distress helpline with the COVID-19 pandemic is that where people are at various stages of this. I think that many of us are still in the heroic and honeymoon phase, where we're really able to see that community cohesion and even be a part of it, while there are many folks who are in that disillusionment phase and many others still who are already having to work through their grief and come to terms with losses that they've experienced as a result of COVID-19. And I think that one of the things that with the disaster distress helpline and that what we're doing with our crisis services that we provide is to be those supports for people who are in that disillusionment stage, because they need that kind of buffer. They need that kind of mitigation against the risk for more serious mental health concerns that we might start to see in the weeks and months ahead. And we have started to see some of those on the disaster distress helpline. I'll just share some of the the trends that we've been seeing in our call and text services. We've heard from callers who are having a hard time managing their stress related to parent and caregiving responsibilities, specifically about homeschooling. We've actually seen a number of calls where parents are having high levels of stress about that responsibility and the stress behind that. We're seeing people who are struggling with maintaining a work-life balance and feeling like they have little time for self-care, because even though many people might feel like they have more time on their hands right now because of distancing measures, a lot of people are actually working 12, 14, 15-hour days, whether in healthcare or other essential or frontline services. And so we're seeing callers reach out to that. Since the beginning of the pandemic and continuing, we're seeing people who are stressed about getting sick or a loved one getting sick, and particularly people with underlying health concerns. And we're starting to see signs of these more serious mental health concerns that can start to creep up and traditionally what's more of the long-term recovery of a disaster. But again, for many people, they are entering that recovery phase already with COVID-19. And disillusionment, working through their grief. And so we are seeing people who are reporting feelings of depression and hopelessness, very strong feelings of isolation and loneliness. And we all know this too, we're seeing a lot of people who are experiencing distress specifically related to finances, loss of employment, and other economic impacts. So that's a little bit about what we're seeing with the Disaster Distress Helpline.
Thank you.
Yeah, I'd like to add. Oh, go ahead.
I was going to say, yeah, I agree with what Christian is saying, and in terms of the impact sort of varying across different communities in the country, I think that the kind of mental health picture that you'll see in the reactions people are having is going to be sort of somewhat dependent upon what's being experienced in the communities in which they live. So if they're heavily impacted by the COVID-19 event, and I'm giving as an example, New York City or Detroit or some of the communities that have really, there's been a lot of morbidity and mortality and people dying and becoming very seriously ill. Those are risk factors that are going to probably result in a higher degree of, anxiety, depression, experience of PTSD and trauma than communities that are either lucky that they haven't experienced that much or just are at a different place in the trajectory of the disease, as it's progressing right now. So, there are populations that we talk about in disaster behavioral health in terms of having high, risk factors that may put them at risk to have a more severe reaction. We talk about children, older adults, and particularly with COVID, I think older adults is a population that may be at higher risk, both in terms of physical illness and also some of the social isolation that folks who are living in nursing homes and sort of congregant living environments who have been sort of isolated and shut down and aren't able to receive visitors. So those folks might be at a higher risk. And then, folks who are already diagnosed with mental health or substance use disorder issues. So there are a lot of things, things that put disaster survivors at either a higher risk to have a more severe reaction, or in some cases there are even some protective factors that maybe help people be less susceptible to having a more severe reaction. There are some interesting populations in this case as well. We always think about first responders in terms of being a high-risk population, and I think that continues to be true. But also in this case, and everybody's probably seen in the media, the focus on healthcare workers as a sort of a separate entity than first responders, and sort of some of the extreme, long hours, being exposed to potential infection with the disease, or even, contracting COVID-19 because of the work that they're doing. And then really some pretty traumatic situations related to, that could be related to moral injury with having to make decisions about At the peak of this event, we were hearing stories about making decisions about who may or may not get a ventilator if there were shortages and things of that nature. So, that is a population that we really have to be concerned about in terms of their exposure and their potential to have, consequences from that, longer term. So.
Thank you. Roger, I think you were trying to pipe up earlier. Did I mishear?
I think Seth was, actually.
I'm sorry, Seth.
It's okay, I'll jump in. So I agree a lot with what Eric said, that some populations are at risk that's going to get acute and tough. But I'd like to shed some positive light. We also say disasters are opportunities. And I could give multiple examples, like after the earthquake in Nepal, we came and created theater therapy across villages and gave a voice for women in partnership with AmeriCares, and actually made them stronger within the family unit and reduced suicide rates and domestic violence. In Japan, we brought art therapy after the tsunami, and it was a way for children to voice their feeling and what they're going through. And even recently in the Fires of Paradise, we work with the Boys and Girls Club to help facilitate the educators and the children to really get through the hardship of the loss of a lot of life in that community and the households. But I would say that when we were in Sierra Leone, when the Ebola outbroke, and we helped contain it with multiple NGOs and agencies, not the whole world wasn't looking. And this is very different because it's a global pandemic and it's affecting all, like my panelists have said, all populations across the world. We think there's going to be a bigger effort and a joint collaboration and more investments to really take care of mental health and help reduce stress and anxiety for the general public, which is going to be very severe and acute. People for a long time are going to feel every little illness is COVID. People are going to go the extra mile for social distancing, even at a stage where it's not necessary, possibly. So as we saw in Puerto Rico, even after a hurricane, people every rainfall fear it's a hurricane. So it's going to be very similar impacts. And we like to call it post-traumatic growth, PTG. So we turn PTSD into PTG, post-traumatic growth, we call it. And it's actually an opportunity to work with communities and caregivers and religious leaders and educators and also healthcare professionals to create programs to really help them embed this thinking and provide to their communities. We were working, we had an immersive program with healthcare professionals in China already in middle of January. We didn't believe, like others, this was going to spread globally. But to be honest, there wasn't much interest of many people to help in China at that time. Now everyone understands it's a global impact, and we're in this together, and it's a global community. And maybe it will unite us all to work and focus on the right things we should be focusing on. So that's kind of a little bit of a positive light for this whole situation.
Thank you. We could all use a little bit more positivity right now.
I think that,
go ahead.
I was going to say, I think to follow up on that idea, I mean, I think that's also, very valid point of view. And I know what we've learned in our crisis counseling program grants in terms of, the typical reactions that most individuals have in response to disaster is we talk about the many, the some, and the few. And the many being, this idea that most people are fairly resilient and would do fine over time and recover. They're going to have some acute, stress and anxiety potentially related problems, but the supports that they have in place in their life, whether it's family or coworkers or if they're children in school and things like that, their teachers and peers are going to allow them to sort of weather that storm. Some people are going to need some additional support, in terms of some psychoeducation about, what they're experiencing and some validation, that, hey, you're not necessarily having a mental illness or a crisis. You're having a normal reaction to a very stressful situation. And then, part of what we do then also is a bit of case finding to say, hey, what you're experiencing maybe is a little bit more and potentially could, necessitate a referral to be evaluated by somebody for some more formal mental health or substance use disorder treatment. So we talk about, that sort of range of, most, the many, a few who need some additional support, and even fewer that need that formal mental health treatment. So it's not all sort of pathology, right? I mean, it's, a lot of folks, will recover over time. And so that, I think, is the good news. And what we need to do is find ways to support that recovery.
Yeah, I really appreciate that. Just the idea of that a lot of what you're feeling is very normal and not necessarily, like you said, something to be diagnosed specifically. And that, as we're all service providers, there's a person behind every service, and they're experiencing that mental and emotional distress. So I think we've all kind of been put in that position that all of a sudden we're caring for not just their, for food or for housing, but also their mental well-being as well. So I think that's a really good point. So as all of you have been providing services in this new and I'll say extreme environment, what are some best practices or lessons learned of that service delivery? I'm sure there are many on that right now that are still trying to figure this out. So I'd love to hear some thoughts on that.
I'd like to jump in, Catherine.
Sure.
Yeah, so some of the things that Team Rubicon is doing, which I really think is the best practice, is for a lot of our volunteers who, are really an at-risk population, they're veterans, they already experience social isolation. We've developed a Neighbors Helping Neighbors campaign, which actually encourages them to go out and do small acts of kindness so they pull out of, that social isolation. And so this is really, still respecting CDC guidelines, and social distancing as well, but just giving people the inspiration and, a sense of purpose through a smaller act. I think it's worked really well. And then also something that we've noticed is, during this whole COVID-19 experience, a lot of the population we're isolated, we're in self-quarantine, we're going through a number of feelings. We have actually increased the amount of virtual events that we have going on to help people connect with other people. So most of the time, our volunteers get that connection through in-person events. So what we've really done is we've translated a lot of our workshops, our trainings, all those interactions to virtual events, which really allows them to get that same connection at a continuous flow. So there really isn't a stop in, how they're communicating with other people in our organization.
Great. I think continuing connection is key.
I think for us, in terms of best practices and lessons learned so far, certainly think there will be many more moving ahead. I think two things. I mean, it's sort of a dichotomy where in the crisis center world, with our network of crisis centers, which are around the country, that's what the Disaster Distress Helpline and Lifeline are. They're networks of independently operated crisis centers. There are over 7,000 staff and volunteers in the larger Lifeline network, comprised of over 170 crisis centers around the country. The Disaster Distress Helpline, we're a much smaller network. We only have five call and text centers in our network, which has about 400 staff and volunteers. But in all of this, creativity and adaptability for crisis centers has been key over the past 6 weeks. Crisis counseling is something that requires an enormous amount of training. The average crisis counselor has about 70 hours of training before they take their first call. You have to learn not just the content of what you're providing over the phone or text or chat, but also how to do it with the technology. And the pandemic has certainly propelled crisis centers to be really creative when it comes to moving towards fully remote staff patterns, accommodating surge staffing. Crisis centers operate in crisis, and so we've always had continuity of operations plans in place for any disaster because we're 24/7 crisis services. We can only suffer minimal disruptions to those services in the event of crises. The COVID-19 pandemic has really sort of propelled us to be really creative about how we think about these kind of operational things. At the same time, I think one of the lessons learned so far for us at the Disaster Distress Helpline has been the need to also hold fast to standards of care. So it's sort of like creativity on one hand and then also tradition on the other hand. Because the Disaster Distress Helpline we launched in 2012 with SAMHSA to guarantee that everyone in the U.S. has access to immediate crisis counseling and support throughout any phase of a natural or human-caused disaster. And over time, through National VOAD, we've worked with other partners who deliver mental health services, not just SAMHSA, but also other federal agencies, with American Red Cross, with groups like NOVA, to create standards of care. We have our VOAD emotional care points of consensus. We have our disaster emotional care guidelines, which hopefully will be approved soon and implemented. And I say this because in the past 6 weeks, we've seen a lot of spontaneous services come up addressing mental health. We've seen various hotlines pop up. We've seen a lot of spontaneous volunteers reach out to services like ours and crisis centers and others, people who want to help. And that's a natural response. But in that, we have to make sure that people are still holding to the standards of care that we worked hard to develop over the years in disaster emotional care and mental health. We can't sort of have this Wild West approach where anything goes. So that's what I would offer in terms of best practices or lessons learned so far, both creativity and thinking outside the box with how we approach our services, but also making sure we maintain those kind of traditional core services core standards that we have in place.
That's good.
Yeah.
I would say that, in terms of the SAMHSA and FEMA crisis counseling grants that are just starting to get off the ground now because we're dependent upon a presidential major disaster declaration that includes individual assistance to make these grants available. One of the big things is in terms of our program model, it usually being an outreach based, going into the affected communities door to door and the neighborhoods that were impacted by whatever the typical disaster is. This is a little bit different, and we've had to brainstorm and think about ways of being able to provide the services, but in a social distancing model. And so what a lot of states have been proposing, we've learned a lot from our state counterparts, but what they've been proposing to do is kind of do this virtual dissemination of information via social media or technology platforms such as Zoom or Skype or FaceTime or whatever they choose, and then also concurrently setting up either setting up their own or supplementing an existing crisis line call-in center where they have crisis counselors will be available to receive some of those calls. And so they've partnered, in some cases they may partner with the Disaster Distress Helpline. We have all these new declarations that just kicked off. They've also partnered with agencies like 211, or they've set up their own disaster crisis counseling crisis line. And so the kind of model that they've been using is get information out there via what we call secondary services or sharing of information. And of course, some of that information is related to, hey, if you're having a severe reaction, there's a number that you can call, and there's a trained crisis counselor that you can talk to about what you're experiencing and what you're feeling, and they can help you sort through some of those issues. And so that's kind of the approach a lot of our grantees have been taking as they develop this. Now, we'll probably see some more really great ideas as we roll out all of these new grants and related to the new declarations we have. But so far, that's what we've been seeing in terms of best practices, I think.
Yeah, I can add that we have to step it up and be more innovative in our approaches. Obviously, most of our professionals prefer the face-to-face and the hands-on experience, and that's how they've always operated. And that's why we always go to the communities and stay long-term as well, not just arrive fast, but stay over the long term. So it has to shift the approach. So for instance, we're launching now a premier site. It's something I didn't know the definition beforehand, what even that means. It's actually a guided experiential site. So it's a site that you ask questions and we can receive replies, and it can create polls, and it could guide a participant through a whole experience as if they were sitting in a room with a group of people. The whole approach to these calls is how to manage it. On some levels, part of the challenge was the beneficiaries or the survivors didn't know how to use these technologies, and now they're adapting as well because they need to do remote learning for their kids or other reasons. So now it makes it possible for us to work with people in different communities through these online technologies as well, whereas the curriculum has to be adjusted to give an experience of the same value and same outcome. So again, we could reach probably more people using these technologies, which has always been a glass ceiling. How do you reach more people with the same manpower? So in the long run, it could help if we can achieve the same outcomes, and the jury's out on that. We don't know yet if we're going to achieve the same outcome.
Yeah.
Right. Yeah, the technology aspect seems to be a blessing and a curse all at the same time. I say best practices, but they're really just tested practices at this point. We don't know if they're best yet.
Yeah.
Eric, I'd like to hear briefly from you. You know, some of our attendees may not be familiar with the crisis counseling program. You know, with all the FEMA declarations, I've noticed that it's the only program under individual assistance that has gone forward, which is interesting. So can you give us a high-level view of that, and are there ways that other nonprofits can partner with you in this?
So I've sort of alluded to the basic approach to the crisis counseling program, and there are two grants that are available. We call you have to have a major disaster declaration that includes individual assistance to be eligible, and you have to be a state, territory, or tribe. Essentially, the grants go to the grantee, and oftentimes they partner with local community mental health service providers or other nonprofit organizations contractually in the communities that are affected to actually do the hiring and implement the outreach. In this case, it may be a little different in a lot of cases with COVID-19 in that some states are taking a more centralized approach and doing some direct hiring. But I still think there is going to be opportunities for partnership. Sometimes the states have, predetermined networks of providers that they're utilizing, and they have, memorandums of understanding with, or network contracts with. And in some cases, they don't have that in every county, across the state. And so they're looking to identify and engage providers to implement the program. So that's going to be on a case by case, state by state basis. And we would just encourage folks that are interested in doing this kind of work at the non-for-profit agency and being engaged, that they reach out to their state partners and find out what the situation is in their state. But that's essentially what happens. And then these agencies take on staff who then implement the program, both with usually with face-to-face encounters, in the community, but now probably more with a call center model of operations, and then a dissemination of information, as I mentioned before. So SAMHSA is involved with FEMA. FEMA is the funder of the program, and SAMHSA provides the mental health oversight and expertise, as well as the grant administration and training, and looking at modifications to the program model occasionally, things like that. So that's how we're involved, and we have an interagency agreement with FEMA to provide that level of assistance and expertise. So,
and Eric,
that's been a partnership that's been around for between 30 and 40 years. So, been a long-term deal between SAMHSA's predecessors and FEMA. So.
And Eric, if folks on this webinar in the VOAD movement wanted to find out about a crisis counseling program, they would typically go through their state's Department of Health or mental health equivalent, correct?
Yeah, that's correct. There are some subtle differences between what we call our immediate services program, which is the first 2-month-long grant that comes out, and then we have a follow-on program that's a 9-month grant called the regular services program grant. There are slight differences in the way those are funded. The immediate services program grant being funded through the state mental health I'm sorry, through the State Emergency Management Agency. So the funding flows from FEMA to the State Emergency Management Agency, and then is transferred usually internally to the behavioral health entity within the state. In the RSP grant, the funding goes directly from is obligated to SAMHSA. SAMHSA makes an award directly to the state mental health authority. So there's some slight differences, but the people that implement the program and run it typically are the state mental health authorities for each state or territory, or in the case of a tribe, it would be the tribal chief executive officer. So.
And Catherine, I would just tack on too to what Eric is saying, because it's such a valuable program, the CCP model, because it really does put the services at the local level. Puerto Rico had a crisis counseling program after the earthquakes and Hurricane Maria that was integral to their recovery and continues to be. And just every state when there's been a major disaster. And I think it is important for folks in the VOAD movement to connect with their crisis counseling program and their state mental health authority. Not just for COVID-19, but to build those relationships now so that we can look to the future.
Mm-hmm.
That's really good. Yeah, I mean, the reality is that there's mental health implications for every disaster, and this one is just amplified, it feels. So that's great advice. So what, I think something that's critical to the VOAD movement is seeing a gap and seeing how we can meet it. So from what you've seen thus far, and I realize it feels like forever, and probably we're just somewhat at the beginning of this. What are some gaps in services that we may be seeing currently that you think will continue on as a challenge?
I think from our end, from the Disaster Distress Helpline, crisis hotlines in general, we've been around for 50 years and over the years have worked to evolve and adapt. And I think we still have a long way to go in terms of access and functional needs. Of making sure that we're connecting with communities who don't have English as their first language, who have sensory disabilities, who have whatever it is that might prevent them from accessing our services for crisis hotlines, making sure that we're adapting. Most crisis hotlines do have language capacity, and we have a 24/7 direct option for people who speak Spanish. In addition to our general hotline and texting service. Almost all crisis hotlines and 211s can connect with callers in over 100 other languages through third-party interpretation services. We have TTY, but what we need is video crisis phone, and we're working on that. Hopefully we will have a video crisis phone for the DDH soon. And we do partner with a crisis center in Missouri called Deaf Lead to provide our TTY and for the Lifeline. And they have a video crisis phone that they operate for the state of Missouri. So we're just hoping to partner with them and expand it nationally. But that's what we have to keep doing. We have to keep looking at what are we doing and how can we maintain those services that are addressing access and functional needs, and what are the gaps, whether it's language or sensory disabilities or cultural competency, I think is a big one for us too. And for us, I think the gap and the challenge too is translating our services also to outreach and communications, because it's one thing for us to have these services, it's another for communities to know we have the services and understand that they're out there. And that's why the VOAD movement is also so valuable, because we can do that within the VOAD movement by doing this kind of networking. So.
Good. So something I would like to shift to is that, we're all part of an organization that has staff and volunteers, and considering the gravity and the length of this response, I think we need to be making sure that we're taking care of them and their mental health needs as they come about. What can we be doing practically within our own organization to help care for our staff and volunteers?
Well, I would say, Catherine, at NOVA, like I said, that's one of the primary focuses that we've been working on, is how do we take care of not only the NOVA staff itself, but how do we take care of those folks that we truly consider to be our constituents, or those people that we serve, which are those folks that are out there doing the victim advocacy, We've instituted a couple of different things for our folks, just as an opportunity or the availability for them to be able to connect with each other. So again, one of the things that we know that's driving some of this for us is isolation and disconnection of people feeling not connected to folks. And so we've, again, looking in the virtual realm, we've created discussion forums for those folks for us that are in those fields to be able to connect together with each other, whether it's to share their own best practices or to be able to talk about the situations that have been coming up for them that they've not been able to find a workaround with, whether that be that the courts are shut down and how do they do temporary orders, any of those kind of things. But the other piece that we've done is to really take care of those folks. And so we were able to marry the two sides of the houses that I think that NOVA has, which is the victim advocacy side and the crisis response side. We've been able to create what we call our touch-based contact program, where we created an email that folks could submit an email into the site. We would be able to pair them up with one of our crisis responders who would actually be able to call them on the phone, and they can have just a quick little crisis session or just a chance to talk or get somebody who kind of understands what's going on for those folks. And we kind of pair folks up. So if we have somebody that's in the law enforcement field, we have, a law enforcement trained crisis responder that can contact them back. And so there's a way for them to kind of be able to speak the same language, be able to talk with each other. And it's what we've tried to get. We've done that for our network of folks, and a lot of folks have said, "Hey, can we start to branch out into having hospital workers call and those kind of things?" We wouldn't be able to manage that, but what we've tried to do is to move that down to our folks at the local level to see if they could actually be able to create that so that folks would be able to have a touch-based program, even if it's just a simple callback, 10-minute conversation just to touch base with folks to see how they're doing. So we've instituted that. And, we still have our direct assistance phone line for folks that they've been calling in. It's usually reserved for folks that are in agencies to call us, but what we've been seeing is that there's this uptick with folks calling in to talk about, identity theft or fraud or any of those kind of things. And a lot of the services that are out there now because of what's going on, they're closed. There's nobody, they're not getting anybody. The IRS isn't answering the phones, and how are they supposed to, get any of those questions answered for them? And so we've been able to find workarounds for folks. So we do have a direct 800 number line that folks have been calling in. And so our goal is to really continue to, keep people connected virtually. We've also done our Wednesday gatherings, and those are all posted on the trinova.org website. For folks for different topics, including the ones that we're talking about here. Grief and loss, suicide's another topic that's going to be coming up for us, and just some sessions for folks to call in to hear. One of the best things we did this past Wednesday was we had a comedian who was in the field, and what she did was just really kind of bring some levity to all of this, and again, that whole we're all in this together, no matter where we are. And so it was a wonderful thing. Those are recorded, and folks can go onto our website to find those recordings as well.
And I will say, if I could just jump in, some of the things that you talked about, Roger, we are also doing as well, utilizing that virtual platform for both our staff and our volunteers. What I think has been really important is trying to keep things as normal as you possibly can in this strange world. For our staff, we definitely have the same meetings that we normally would have. And for our volunteers, we have the same, experiences virtually that we normally would have. And we really just try to keep people engaged so they're busy and so they're focused on doing something. And so I know for staff, we have various challenges related to health. So we encourage all of our staff to take care of themselves so they can help take care of our volunteers. And honestly, for us, that biggest piece, the constant communication, just really trying to keep things as normal as possible, and, letting them know what we're doing so they can give us feedback and work with them.
I will just
one of
jump
the other
in
things
and
that,
say,
sorry.
I was just going to say that we really enjoy partnering with Team Rubicon. The one thing that's still missing, Natasha, is usually at 8 o'clock there was beer to everybody, so that we still can provide virtually. But I alluded to this before. Self-care is a big issue. After Haiti, the world came together, the humanitarian aid organizations and the UN, and really made self-care at the forefront of humanitarian aid organizations and relief organizations. And it's not a maybe, it's a have to. Every organization in their HR department will have a dedicated person focusing on self-care of all staff members frequently, formally and informally, and also volunteers. And it has to be in the process and in the program. And again, if we don't take care of our staff, there were many stories of people coming back for missions or helping refugees, et cetera. And they really went down that spiral Eric alluded to before. And you want to catch it early and give them the attention and know if you have to find people that need to be referred to a higher level support. It's really important to have that in the system. And you know, what we're doing with Team Rubicon now is when we're volunteering at food pantries for veterans, it's important to have purpose. But for all people at these times, it's important to have purpose. When people volunteer, we say first you're helping yourself be more meaningful and feel more fulfilled, and then you're giving back to the people you're helping.
I was going to say one of the
That's
things
great.
that we have done for staff too is that in this time, this virtual world and being home or working from home, there's kind of this thought that people will be extra productive or that there's an expectation of more productivity. And what we've said is that the reality here is that may not be the case, that you are stuck at home. There are people that are trying to homeschool their kids or whatever. So we've lowered that expectation that says we're not expecting you to produce more because you're there. And I think that that's another thing that we should let folks know because that way you have an expectation that you can take care of yourself or the things that you need to take care of for yourself while you're at home. And I think it's kind of counterintuitive. People think that they can get up in the morning and they can start work earlier because they're not fighting traffic. And then they end up spending more time at work instead of that work-life balance that folks talked about earlier.
That's great. So I have one more question, then I want to jump to the chat. So look, we all know that this is going to be a long time, you know, a long-term recovery for sure. And individually, who knows? So what can we be expecting down the road? You know, 6 months, a year, 2 years. What do you think some of the mental health implications or variances we are going to see?
Well, I think that some of what we've touched on in the webinar in terms of the risk for more persistent or serious mental health concerns, whether that's people who had pre-existing mental health concerns before the pandemic and are being aggravated or exacerbated. It could be people who have had a high degree of exposure during the pandemic. They've lost someone, they've been ill and seriously ill. They've had financial distress. It could also be people who have had their access to care impeded during the pandemic through distancing measures. And so, but that could be weeks from now, it could be months from now. It's sort of hard to predict. So I think that the takeaway there is to make sure that we in the VOAD movement, as well as our funders and government partners, and just stays focused on that. And I always like to say too that, and I touched on this a little bit earlier, but those of us who are still in that heroic or honeymoon phase, we need to keep an arm in that of support, of a lifeline to the folks who are really struggling. And certainly those of us on the panel and many of the folks in the audience are going to do that, but we just need to keep that up and really keep encouraging it. And I think it's also about looking to the horizon, because in the phases of a disaster, it's like a roller coaster. Eventually it does go up and you sort of do reach a point where you feel like you've adapted, you might be adapting to a new normal or whatever that is, but that's resilience. And that's hope. And SAMHSA has a saying that recovery is possible and happens. And it's sort of very matter of fact. And we need to make sure that people stay focused on that support them in their struggles and empathize and validate. And also that there is this point where it might be months, it might even be years for some people, but it's there, it's on the horizon. And that kind of post-traumatic growth that Seth was talking about earlier too.
That's
so that's
good.
my takeaway.
Yeah. I know no one can predict the future. Yeah.
I would just jump in and say we should look at this as 6 months or a year. We should look at this even as a 3 years solution, at least. Yeah. And the longer term we think, the bigger impact we will have. That's the only point I'll make. Think of it, the people that are dealing with this on the forefront with emotional care and mental health and anything in this space should think really long term, especially with the most affected areas.
Right.
Yeah, I would completely concur with that. One of the things we talk about in the crisis counseling program is that we're time limited, by the law in terms of how long we can function, up to about a year. But we fully expect that for those in the community that were more severely impacted by whatever the disaster is, they're still going to be in the recovery process when the crisis counseling program phases down at about a year, and maybe for a good long time after that, another 6 months or a year or 2 years after that, depending on what their losses have been. And so what we try to do is work to transition those services back to the community, and make sure that we don't leave sort of survivors that are still in the recovery process to go it alone, but we've left them sort of connected to other community resources that can continue to help them, because we do fully expect that the process, although we're time limited, can take longer than that for people that are severely impacted. So.
Right. A related question in the chat that I'd like to pose is, what are some resources that you would recommend for proactively preparing staff and volunteer to re-enter the field post-COVID? So we're seeing people, slowly places are starting to open up. We've had natural disasters happen where volunteers and staff are being deployed. Is there anything we can do to help prepare them for re-entry, I suppose?
Yeah. From my perspective, I think one of the most important things people can do is pay attention to good information. Risk communication in any disaster environment, whether it's COVID or any other kind of disaster, is very important. So people need to educate themselves as to what the situation is, what the precautions that they would need to take, even if they're, reintroducing back into the community, and go to trusted sources of information, whether that's CDC or their state or local public health, agencies, or mental health agencies, in terms of just, getting information from appropriate resources. So.
I think that's a great question too, Catherine, that I'll take away from this and bring it back to the National VOAD Emotional and Spiritual Care Committee, as well as the Disaster Health Committee, to make sure that we're sharing resources. Yeah,
I think it's important because, I know even for myself, as reentry happens, I'm like, well, I'm not going out there, and I think there's a trepidation and an anxiety that comes along with just everything we've experienced. And there are those who want to serve and want to serve fiercely and, quickly. And, how can we do that in the most healthy and safe way possible? One last question, we're over time, but what resources are available for children who are grieving loss of routine, classmates, activities, etc.? I know there's been a huge burden placed on young people as their lives have been turned upside down.
I'll give a quick shout out to one of our partners, another partner via SAMHSA, which is the National Child Traumatic Stress Network, or nctsn.org. They have a comprehensive library of resources for parents, educators, and other caregivers impacted by COVID-19 and any natural or human-caused disaster, also available in multiple languages. So I would point folks to nctsn.org to find many tip sheets, and they even have a coloring book for kids about COVID-19. I know Headwaters Relief, which is also a VOAD member, also just came out with a coloring book for children about COVID-19. So those resources are out there.
And I would enter that our webinar that we're having, one of our gatherings on Wednesday on May 20th, is focused on this topic specifically. So how can folks help kids get back to those routines, those kind of things. So Dr. Bell will be talking about that. Folks can go onto our website and they can register for it. It's free.
Great. I'll also say that we've recently come into partnership with Sesame Workshop, which is affiliated with Sesame Street, and they have a whole line of resources and videos both for families and kids who are currently in an emergency or crisis or coming out of it or how to prepare for it. So we'll be distributing those, but I'm sure you can Google and find them for yourself as well. Unfortunately, we are all out of time, but I so appreciate all of you being here and what you're doing. And this is long and hard and complex. And I just hope everyone that was here today was able to take a little something to take back to their community, to their organization, even to their home. And, Seth, I really appreciate what you said. You can't take care of others if you're not taking care of yourself. So please take those moments for self-care and, call a friend, call a family member, call a neighbor. And that's how we'll get through this together. So thank you all for your time.
Stress the right family members, I'll just say.
Sorry?
Call the right family members. Some create more stress. So thank you very much.
There are stressful family members. I appreciate that advice. All right, thank you all, and we will be distributing this recording via email, and stay tuned for our next webinar in this series. Have a great night.
Thank you, Catherine.
Thank you.
Thank you. Appreciate it.
Take care, everybody.